So welcome, Nick.
Hey, Talia. So good to see you again.
Yeah, good to see you again. Yeah, we met in the IMMH, the Mental Health, Integrative
Good.
Medicine for Mental Health conference in 2019.
hmm Yeah,
And
seeing you again gives me all these flashbacks of that amazing conference.
yeah, I know. Yeah, last year was just online. Obviously, it was 2020, and then this year, apparently, it's live again.
Oh,
I don't
wow.
know if you're not planning on going.
No,
Yeah,
no.
yeah, you're busy. So
I've
yeah,
actually
maybe.
gone, I think I've gone to three or four of those, and they're great.
Mhm.
Right now, I'm just kind of nose to the grindstone with everything I'm doing right now.
Yeah, so maybe you can introduce yourself and what you're up to right now because you're into something really interesting at the moment.
Yeah, yeah. Right now, I am focusing on helping families get healthier, transition to a healthier lifestyle. I try to do it in a way that's easy and painless and quick. Um, and I'm passionate about that because of my own journey of trying to figure out healthy lifestyle, right?
Mhm.
And I focus on families because I have four kids, and I've watched them grow up. They're 18, 15, 10, and 8 right now.
Okay.
And so, it's I've watched them, and I've been very conscientious as a father to try to get them to develop in all ways in a healthy way,
Mhm.
mentally, emotionally, and physically, and everything. Um, and having been a nutritionist for years and studying biochemistry and being in the medical field, I'm like also very conscientious about what they're eating. Are they getting enough nutrients? And
Mhm.
I'm that dad that's chasing them around with a spoon of cod liver oil, right?
Yeah.
Eat it.
It
But
tastes
I'm
like lemons. Yeah.
What's that?
It tastes like lemons. Please, I swear.
Yeah. No, they finally get to a point where they're just like surrendered to it. Like, yeah,
Mhm.
there's no getting away from this crazy dad.
Yeah.
Um, so, but the reason I'm so interested in that is because, the more I've studied it, the more I realize how important nutrition and avoiding toxins and other things are for the development of children.
Mhm.
And so that's why I do what I do. Um,
Mhm.
and I have a
Nice.
website, blog, mindwhale.com,
Mhm.
where it's probably a little bit more geeky in the scientific realm,
Yeah.
um, talking about everything from hormones to, micronutrients and gut flora and stuff, as it relates to mental health, but
Mhm.
also having to do with mindfulness and meditation. So there's very much like that
Mhm.
psychological and spiritual component to it. And that's the interesting and complex thing about mental health is it really is the epicenter of so many different inputs,
Mhm.
as
Mhm.
you're well aware. Nutrition is super important, and then the social environment, traumas, thought patterns, spirituality. It's
Mhm.
really like how we feel and how we behave is it's such a complex system going on.
Mhm. Yeah, our brain is so complex, and it's not, and our mind as well is not necessarily contained within our isolated self. It's a negotiation between us and the environment. So nutrition could be one inroad to healing mental health, but for someone else it might be mindfulness or working on relationships, mindset things. I have a theory, a pet theory right now about the prefrontal cortex, so the part of the brain that, and we'll get into families and nutrition. But the prefrontal cortex, for the audience, the part of the brain that essentially like makes decisions for you, that probably most people associate with their own conscious mind, with their decision making rational mind. It's sort of the part of the brain that we focus on in cognitive behavior therapy, right? Like our mind controls our emotions, like that kind of thing. So if you have anxiety, sort of talking yourself down or calming yourself down with more rational or balanced thoughts. And so my theory is like our prefrontal cortex, when it runs out of energy, our whatever's lying beneath, so our limbic system, our amygdala, is now at the forefront. And so you can kind of approach mental health from two avenues. One is to strengthen your prefrontal cortex, like keep it fueled so it's online more often, either
Mhm.
reduce inflammation or keep your, like, I'm obsessed with blood sugar. And
Mhm.
then the other part is to address the contents of the subconscious, right? So it's going to be shaped by trauma, past experience, and things like meditation, mindfulness. I think it works on both levels, because
Mhm.
you get some more agency over your actual conscious mind. You can strengthen the ability to um, almost like redirect your thoughts, or to at least like watch them, and more awareness of sort of what comes up from the
Exactly.
subconscious. Yeah.
Yeah, I love that. Yeah, that's such a rich topic, actually.
Mhm.
The dynamic between the prefrontal cortex and the limbic system.
Yeah.
Um, it makes me think of Freudian theory with
Mhm.
ego and
Right.
id, right? So, the limbic system is very emotional, very reactive. It's tied in with memories, trauma
Mhm.
is tied in there. And so it's just a very quick, reactive, like gut feeling, more
Mhm.
corporeal, more connected because it's like at the center, like of your brain, right? But it's connected with the rest of the body really intimately.
Mhm.
Um, and so, in like the Freudian theory, the id is that emotional center, like just those raw desires and motives and stuff like that. And it's been compared to like a horse, right? So, like a
Mhm.
horse is this wild, it could be this wild creature, like a wild horse. But the prefrontal cortex is like the rider. So it's, the horse rider, and it's there to kind of rein it in. You know what I mean?
Mhm.
Um, and
Mhm.
so you could have a super wild horse, AKA it's like traumatized, or it's like um, doesn't have the physiological needs that it doesn't, it's not, they're not being met. And so it's like starving for whatever, for love,
Mhm.
or certain nutrients, or there's inflammation in the body, making the horse go wild. But then you have the prefrontal cortex
Mhm.
that is there, and it kind of has those connections like reins that it can
Mhm.
kind of soothe the horse and be like, I know you're triggered right now, but all this huge audience that you're looking at, they're not going to eat you,
Right.
or things like, imagine they're all in their underwear, right? So the prefrontal cortex kind of has this logical control over the rest of
Yeah.
that. So in terms of mental health, that's a huge thing. It's strengthening that prefrontal cortex. And like you said,
Mhm.
having the nutrients is important, and many forms of meditation and mindfulness will directly strengthen that as
Mhm.
well. Um, Another fascinating thing for me, and tying it back to development, is ADHD is associated with abnormalities in that functioning of the prefrontal cortex, and also other like mood disorders like depression and anxiety. Um, but developmentally, one of the biggest associations that they found in research is iron deficiency or iron deficiency anemia in the mother during pregnancy leads to less development of that prefrontal cortex in the baby, and then higher
Mhm.
risk of ADHD and other
Mhm.
mood disorders. And again, and then also certain plasticizers and neurotoxins in the environment that we need to watch out for. Things like PCBs and heavy metals, those are huge. Those really hamper the development of the prefrontal cortex. So,
Mhm. Mhm.
um, just knowing how to navigate that as a parent and as a soon to be parent is really important, because we want our kids to have, biologically, we want them to have that develop correctly. And then, of course, during pregnancy and after birth, we want them to have those those healthy relational
Mhm.
inputs and stuff that are going to support that healthy development. So anyway, I don't know if I closed the loop
Mhm.
on that whole id ego thing, but the ego, and you could compare it to the prefrontal cortex. It's that's the part that's kind of a little bit more rational, and able to kind of you know control the horse, maybe with self-care, let it go out to pasture sometimes, right? But then
Mhm.
not let it run amok and stuff like that.
Yeah, like it's like becoming a more skilled rider. essentially.
Exactly.
Learning how
Yeah.
to, there's a woman called Marissa Peer that talks about learning how to drive your Ferrari. Like, you get handed this Ferrari and you're like, I have no idea how to drive this properly. And so you become more skilled at it. It's like how to manage the mind. But I
Mhm.
probably, like, people who really know neuroscience would probably think that's very simplified, like the prefrontal cortex and the limbic system. But I think that's ultimately what a lot of therapy is applying, that basic concept. I'm
Mhm.
even thinking of like parts work where you have your parent or your adult self and then your inner child. So you're like, you're healing the inner child. So you're working at the level of trauma and emotion, um, and self compassion and those kind of things. But then you're also attending to the parent or the adult who's
Mhm.
ultimately in charge of like helping you function in life. So, and I
Mhm.
think with nutrition, we can work, you can address that concept with nutrition, right? Like, especially with blood sugar. And I don't know, I keep repeating myself about blood sugar because like I
Mhm.
always like I don't know, I want to like drive it home because blood sugar doesn't sound like such a sexy concept. People are like, yeah, have a snack often. I'm like, no, you don't understand. At 4 p.m. when you have that daily depressive episode, that's your blood sugar. Let's talk about it, you know?
Exactly. Yeah.
Yeah.
And the thing that I teach clients about that blood sugar concept is it is addictive, and it's kind of it's tricky because I think we do get happier when we eat sugar
Right.
briefly,
Right.
but that, so there's a spike, but then we crash and we're lower. But when we control our blood sugar, we're just at this baseline higher
Mm.
level consistently. And
Right.
so overall, we're much happier. And then we start to learn to get that high from other things
Right.
besides sugar, you know.
Right. The secret to evolution, right, is to, well, maybe do you mind sharing your story about how you decided, because when I met you, you were focused on the mental health side of things, and now you've pivoted, really focusing more on coaching families. And what was the pull towards that? So you mentioned your family, your kids, and just your understanding, like your direct firsthand experience working with them.
Mhm.
Um, but why was that relevant? Maybe it was just something you fell into because you had the experience and the
No,
competency
yeah,
behind
it's
it.
that's a great question. I'm happy to answer it. I am 42 years old, and I grew up with anxiety and depression,
Hmm.
and I got interested in nutrition early on just because I was reading my mom's Reader's Digest and would talk about fiber or something. I'd be like, oh, that's so cool.
Yeah.
um, or supplements. So I got into it, but it was a long journey of going through many different, dietary philosophies and stuff like that. I was never overweight, so I wasn't in that rodeo, which can be crazy, I know.
Mm-hmm.
But I did start making this connection between what I ate and how I felt. And I was going to say I'm a unique case. I'm not really unique because so many people's, immune systems are getting messed up because of, you know, environmental things and these developmental things and poor diets and stuff like that. But I kind of had I started recognizing this connection between my allergies. Like I had hay fever really bad. I had mild asthma. I had a lot of food sensitivities, but I didn't even know that until my early 20s. But I started recognizing that bodily inflammation was affecting the brain. And I was like, no, duh, the brain's part of the body.
Mm-hmm.
So if the body's inflamed, brain's going to probably be inflamed, and it's going to affect the mood. So brain fog I see often as, it could be caused by inflammation. It's a
Mm-hmm.
major cause. But then there's also the micronutrient thing. Like I mentioned, the iron. I had anemia as a kid. And then I feel like I had ADD. I was never diagnosed. That triad of ADD. I just started making these connections. I got a master's degree in biochemistry, and then I was able to geek out on the deep shit, right? The PubMed stuff, and make even more connections. And it's hard to like externalize what you're learning, but then when you read all this stuff, um, for example, like BPA is affecting the development of the hormones, and then how the hormones affect the brain. I mean, there's thyroid, there's insulin, there's the whole blood sugar thing. It's so
Mm.
complicated, and there's so many ways that the brain chemistry can be imbalanced. And also, I focused heavily on spirituality to try to help myself, psychological stuff, did a lot of inner work. And basically, I was suffering as a kid and as a teenager. And it was hard, and I know it's hard for most people. Um,
Mm.
and point being, when I started having kids, I was like, I'm not, can I swear on this podcast?
Yeah, sure. Everyone always asks. I'm like, yeah, we
This
just
is
get
a
into the
family film,
specific. Yeah.
but maybe not swear. I
Yeah.
was like, you know what? These kids are not going to go through that. Like, I'm not
Mm.
going to let them get asthma, allergies. Like, oh, I had digestive issues, IBS, probably some sort of colitis, if we're being honest.
Mm. Mm-hmm.
So all these things were happening, and I did not want my kids to go through that. And so I was studying, nutrition and health for my kids. And I believe it's made a huge difference. My kids are awesome. They're healthy. They don't have asthma. They're, just really well adjusted. And I think a lot of that obviously has to do with getting that relational, psychological love, support, having loving parents, but also the physiology. It's a huge thing. Blood sugar is just as important for kids as it is for adults, like you're mentioning.
Right.
And
Yeah.
so, I, and when their mom was pregnant, I would, research about, the different micronutrients, iron, um, zinc, selenium even is associated with stuff. I think about 10% of kids are born either small for gestational age or prematurely. And that just being born early is super traumatic. But it also evidences that the child maybe didn't get the nutrition that they needed, because there are various studies showing correlations between certain dietary patterns, which, hint, hint, is not the standard Western diet,
Right.
are associated with better birth weight and less preterm delivery. And autism, there's all sorts of correlations with environmental health, especially detoxification and environmental toxins being associated with the development of that, as well as ADD, and then micronutrient deficiencies. And then schizophrenia and psychosis. Psychosis, they can prevent, it's shown a prevention of psychosis in adolescents that are at risk for it. They're showing signs of pre-psychosis. And for example, they gave them fish oil, and that prevented a huge percentage of them developing it. And that was with a controlled trial. And then, yeah, so there's, I could go on and on and on about that. But so, omega-3 fatty acids, important for the brain. A lot of people aren't getting it. Our diets are skewed. And so with my kids, that's why I'm chasing them around with cod liver oil. I don't chase them anymore, by the way.
Yeah.
Now it's like, come get your cod liver oil. I might have to tell them a few times, but they'll come and I just pour it in their mouth.
Yeah. Yeah. Well, the interesting thing too about your story is I'm sure that when you were going through all that, there was just probably this assumption, like in our medical system, you would most likely be told, well, it's just genetic. This is just the cards that you're dealt. There's nothing you can do about it. And then you see, with four kids, right? So that if it is genetic, the chances that one of them would be suffering with those things is high, right? If it was just a purely genetic hand of cards. And I think, nutrition is so undervalued in our system. And even just like, I always think of it like a lot of people get benefit from fish oil. And in fish oil, the EPA in it, is just one of the nutrients that the brain requires that we're not getting in our standard American diet. Or, any variation of the standard American diet. Let's say someone goes keto, but they're usually their foundation is the standard American diet. Now they're just tweaking it a little bit. As I'm sure you did when you started your journey. I did when I started my journey. I kind of just took one variable and changed it slightly, but it was still sort of, Canada's food guide or whatever you have, USDA, and food pyramid or whatever it is.
Right.
And we so when I think of like all the nutrients that the brain needs, and all of the things beyond EPA, but how much of an effect you can get from just adding one nutrient,
Hmm.
even isolating something like iron down to improving outcomes, like, in the risk of a child developing ADHD. And like, for example, so many of my patients come in low iron, and the way that it's framed in their healthcare is, oh yeah, your iron's low, it's always low. Oh, maybe you're menstruating, it's
Um,
normal, or you're vegetarian, normal. Here's, a high dose iron to take
mhm,
that doesn't get absorbed. And so they're struggling with low iron their whole life, and it's sort of this, one of my colleagues and I always joke that iron is sort of like the non-sexy nutrient because everybody's low in iron, but
mhm,
we need iron to make dopamine, and dopamine is essentially, so someone will come in with low energy, low motivation, low libido, low focus, difficulty concentrating. And so
mhm,
we have all these symptoms that are very significant to how they function, how they perceive or enjoy their world, and we can link that to iron,
mhm.
this chronic iron deficiency that they've dealt with. And so part of it too is just like making nutrition exciting, connecting it to someone's experience.
Exactly.
Yeah.
Yeah.
Hmm.
Yeah. I'm all about the motivation and, knowledge is power. And when people understand what the effects are,
Mm-hmm.
it
Mm-hmm.
becomes self motivating. It becomes easy. It's
Yeah.
like, oh, when I eat this way, I feel crappy. Or when I eat this other way, I feel really good. It's no longer like this willpower thing.
Right.
It's like, it's just a no brainer.
Yeah.
Um, exactly. Yeah, and the iron is interesting too because it's not necessarily that the person's not getting enough iron.
Mm-hmm.
There could be inflammation that's decreasing their ability to absorb the iron that they're eating. So that's the other complicated thing about nutrition. It's not just like add a bunch of nutrients and everything's good.
Right.
You know, it's really decreasing that inflammation, which is a whole other side of the equation. But that's what I do with patients is I teach them these concepts. I teach them the consequences through mindfulness, tracking their symptoms with themselves and with their kids. We'll track the child's focus, mood, bowel patterns, stuff like that. And then they'll start seeing those connections. And then with the parents, a lot of people deal with fatigue and or low energy, and then we'll get them mindful about that. So it's all about mindfulness. Like once you understand, and then I also share how like blood sugar, for example, it's not like these things are researched as much as maybe pharmaceutical drugs are because there's not much money in it. But the research does show that blood sugar control and glycemic load is highly correlated with acne, for
Mm-hmm.
example. So there's all these things are affected by nutrition, but yet how do we deal with acne? We say, oh, it's just a normal thing of adolescence, and people get it, and we'll give you these topical whatever to get rid of it. But acne is coming from the inside out,
Yeah.
and so much of what we deal with is coming from the inside out in
Right.
that way.
Right.
Um,
Yeah. So we give you a liver toxic drug that, and your liver's responsible for regulating your blood sugar, but that's fine. Yeah.
right.
So, yeah. And
Yeah.
how do you, so when a family will come in, is it usually the parents that seek your services, or how do they
Yeah.
find you?
Yeah. It's usually parents. I have a network of physicians and stuff that will refer to me. Um, so that's primarily how I do it. And then they just, usually if the, practitioner understands functional medicine and, integrative and naturopathic theories and stuff, then um, they'll see the importance of it. Um, a patient will come in and, if the practitioner is aware of how nutrition affects the body, then yeah, people will listen to the practitioner and and they can explain like, hey, I think what you're dealing with may be helped by better nutrition.
Mm-hmm.
Um, and but there's a lot of different I think people are more and more aware of it. We're probably reaching a tipping point where even if people aren't practicing healthy lifestyle, they're getting more and more aware of the
Mhm.
details of what could be done because they're seeing other people be really, adamant or vocal about the benefits that they're seeing.
Right.
So, yeah, I think they're starting to know it. And then when I talk to them, it kind of makes intuitive sense, but I'll paint a more vivid picture, like with more of the nitty gritty in a more organized fashion, like eat this and this and this, and this is why, and then try to avoid this and this and this, and this is why. Try to avoid this type of food because it has more of this type of toxin, stuff like that. And then it's more it goes from this theoretical realm of like I should eat better and I know I should probably eat more fish oil, but whatever, I don't know how to do that,
Right.
to down to like, oh, okay, so like I understand all the concepts and he's walking me through where to get the recipes, like what to look for, and then we're slowly transitioning the family's eating habits more rapidly, depending on, it's a personalized thing, into eating in this other way. And I also help them with, what they might call a difficult kid who
Mhm.
just wants to eat um, junk food, work through that. And yeah, it's
Mhm. Mhm.
awesome.
'Cause that's often like an obstacle. Like so that's why it's so exciting what you're doing because like we mentioned before recording, I'll have so a couple things. Like one, the parent. So my patient will be a parent, and they will maybe be in charge of the cooking. And then when I'm giving them advice on how to tweak, and I usually am, I want to ask you how you kind of approach things, but usually I'll start with maybe like adding one thing, focusing on one thing. Like it'll be a bit strategic and it'll be gradual in the majority of cases, just to reduce the overwhelm. And usually what I'll hear is, okay, now I got to make 3 meals because my partner eats this, my kids eat that, and
Mhm.
now I'm like, and you're just adding more to my plate. And in my head, I'm thinking, well, everybody could benefit from following this because this is more universal, foundational
Mhm.
health advice. That's one aspect. Then the other one is that parents will refer their children, and so it might be a teen or maybe a 9 to 11-year-old child who has maybe behavioral problems or is suffering from a certain symptom, and now I'm tasked with trying to get them on board,
Mhm.
you know and then relaying the recommendations to their parents, and it becomes almost, in the eyes of that kid, it can feel like punishment. It's like, oh, she's taking away this and now I'm doing this. And it's also very tricky, I think, for me at least. I'm not a parent, to give advice to parents because there's so much in the context that I am aware that I'm unaware of. And so I'm wondering how, that plays in. Like, do you put everyone on a program, or are you more like gradual, or is there a specific problem in the family that you're working, like one person in the family is dealing with a certain symptom,
Mhm.
or like,
Excellent questions. Those are all very important
hmm,
to ask, actually.
there's a lot of
Um,
questions at once.
so
Yeah.
yeah, I'll start with the last one. Yes, sometimes the family will come because their child has focus issues or something like that,
Mhm.
some particular thing. But the reason I focus on families, and I don't want to deal with people that think that we're all just separate silos.
Right.
That's not the best way to put it. I want to tell people that we are a network, and especially a family. That unit, it, everyone's going to benefit from a healthier diet. I don't care how old you are. There are universal principles of an optimal human diet.
Mhm.
Yes, there are differences, but I get people to that baseline, and then we can tweak from there. Um, what you said about making 2 or 3 different meals, that is stressful.
Yeah.
Like that would be stressful. And again, there's this baseline human diet. Everyone, you don't have to be making different meals for
Right.
everyone. I mean, maybe someone is allergic to strawberries, right? So maybe you'll take the strawberries off their plate,
Mhm.
for example. But the basics of how I teach people to eat is universal.
Mm.
It's stuff that's going to give them the right amounts of vegetables, right amounts of protein, quality protein, the right types of healthy fats. Um, and, also another reason, um, that unit, if the mother and the father and the kids are all unified in this single, direction that they're going, it's so much more powerful, so much more effective. Um, and so, maybe as practitioners, we need to educate them about that and just be real. Like, I know you're not going to want to hear this, but
Mm.
I'm going to need to talk to your whole family,
Mhm.
and
Mhm.
we're going to all need to be on the same page. There is a benefit, like with kids and teenagers, to having a third party that's not, nagging mom or whatever, that's always telling them to eat well. Like, oh, Talia, she's cool. She's, like hip and everything. And she's also telling me the same thing. It makes people,
Right.
the kids and stuff, think about it a little bit longer. So there's definitely a benefit to that. But, and you can, it is okay to do one-on-one sessions. But again, like most of my clients, we talk as a whole family.
Mm.
And I'll kind of talk, I'll begin the meeting with everyone there, and talk about, I show pictures, like I'm heavy with the PowerPoints and showing pictures and visuals of the food, and show that with the kids there. And I'll ask the kids questions like, what of these foods do you like? What do so just get them involved, and then teaching the child about cause and effect, for sugar, for example, since that's so important. This makes you feel happy at first, but then a lot of times it makes you feel sad later. And
Mm.
so, kids will kind of get that, but kids have a smaller attention span.
Right.
So, and I'll monitor that. I can kind of see on the video or in person, like what their attention spans at like. And then I don't want them to feel like this is a major drag, so I'll cut the kids loose and then talk to the parents.
Mm.
Um, and
It's a good strategy. Yeah. So
yeah,
get them in a little bit, but you don't overwhelm them or bore them. You keep it exciting, and then they go off and they can play or do whatever now. Yeah.
yeah, and then they're in the loop too. So when mom and dad are having, changing the diet, they're like, oh, Nick also was talking about that. And so it's it is about that community.
Hmm.
We're not in silos. It's you know it's kind of a tribal thing, right? Like if the rest of our tribe is doing a certain thing, it becomes so much more easy to do that. So yeah.
Yeah, and I think, food, this is one thing that I don't think a lot of maybe nutritionists or nutritional programs acknowledge is this idea that food is very social for human beings, and it's you know it's interesting. I mean, this is a North American thing as well, where food is this commodified, very commercial enterprise. Like we have kids food, that's very
Oh
unique
wow,
to North
yeah.
American culture, right? Like kids get special food. That's not
Mm.
it's not
Exactly,
right.
exactly.
Yeah.
Yeah, and I remember you had asked about that, like the different
Mhm.
meals. Like, for sure, yeah.
Yeah.
Kids, they don't get their own food.
Yeah.
It's a social thing. We're all humans. Yeah, babies drink breast milk,
Yeah.
then they go right into eating, you know,
Actual food. Yeah.
actual food.
Not
uh,
yeah, like, so friends that they buy packs of Mr. Noodles. Oh, these are for my kids. It's like, but this is a developing brain, and you recognize that you wouldn't feel good eating this. So there's sometimes maybe it's a some misinformation that kids can. I think also this is another thing, and you mentioned too when you're telling your story, you were never overweight, and so your health journey took on a different spin. And often what brings people into a nutritional journey of exploring their nutritional habits and their food intake is because they're trying to lose weight. That's and often when I'm speaking of nutrition, I think I'm talking about nutrition with people, like just being healthier, happier, a more fulfilled human being. And then what I hear back is what other people heard was we're talking about weight loss. And so sometimes maybe the issue with, kids get different food is that kids rarely struggle with
Mhm.
being overweight typically, as a
Yeah.
rule.
Mhm.
It takes a while for nutritional deficiencies and toxicities to catch up to them. But at the same time, their brains are developing, and this is like a crucial moment where you can set them up for a lifetime of
Yeah.
health.
Yeah, I've heard way too many times people say, "Oh, you're young, you can eat whatever you want."
Right. Yeah. Or like even friends will be like, "Well, I can eat whatever I want," but you feel terrible after you eat that food. It's clearly inflammatory for you.
Mhm.
It's not whether you gain weight or not.
Right.
It's I'm exercising so I can eat this, but if you
Yeah.
care about the exercise you're doing, it's really important
You're
to fuel
you
properly.
yeah, you can't outrun a poor diet
Right.
for sure.
Yeah. And the weight
Eating
gain is, yeah, maybe a far along symptom of something else going on, like inflammation or chronic stress or something that may be related to food, but possibly not just calories as the only metric that people tend to care about.
exactly. Mhm. Yeah,
And
there's way too much emphasis on calories. There's that epithet of eat less, move more, as
right.
though just do that.
Yeah.
Simple, right?
Yeah. Reduce the whatever. Yeah, so then you end up on those like little calorie cookies that
Yeah,
and
yeah.
this is, and then
And
you start making nutritional choices based on that. Oh, I can't have an avocado because it's this many calories, but also I'll have this little like
oh,
granola bar thing instead.
yeah,
Yeah.
yeah. Whereas the avocado is very healing.
Right.
Fats, low glycemic. You know,
Right.
really good for the metabolism. Yeah, it's sad. And then people will, go to the gym and maybe start counting calories burned, and it's really disheartening when you realize you have to run for 5 hours just to burn off that cake that you ate.
Okay. Yeah.
It's like, wait a second.
Yeah. Yeah.
Sounds simple, but this is hard.
Now I have joint degeneration and no collagen to fuel it because I spent those calories on cake. Um, and I think like so with like what was my other question that I was asking? Well, I'm curious. So do people get? Is it a program typically? It sounds like you have PowerPoint. You have certain instructions. You start with education first, and then there's a plan that follows. And
Yeah,
it's sort of an all-in thing.
yeah, yeah. Usually takes about 4 months to get people's habits turned around for the most part.
Mhm.
Um, and yeah, it starts off heavy with education, getting people a foundational baseline of what to eat, what not to eat, and then it becomes clear. And then we start working into preparing for what I call the illumination diet. It's an elimination diet. Um, and that can be as involved or uninvolved in terms of like eliminating foods as the person's comfortable with. And that's where the personalization comes in. We don't want to overwhelm people, but the traditional elimination diet would eliminate the major you know allergens
Mhm.
like dairy, wheat, corn, soy, eggs, nuts. um, but also there's we're eating these healthy foods that have the right proportions of foods, and that's another aspect of what I teach. Anyway, get these good recipes and stuff so that in month 3 they do that month of the elimination diet. And then and the huge thing about that is they kind of eased into it because the first couple months they were getting new recipes, and then third month they really strict. I just remind people this isn't forever. This is a mindfulness exercise to see how you feel after a month of this.
Mhm.
And then you can choose from there. It's not like you're giving up sugar forever or anything like that. And so it works really well, kind of ease them into it. But then there's this strict period, and people get really, it's like really eye opening. Like, wow, I felt so much better. My inflammation went away. My joints feel better. My
Mhm.
child is sleeping at night, and they're paying attention in school again, and they're
Right.
not throwing tantrums on the floor anymore, and they're not constipated, and
Right.
all this stuff. And so that's where it kind of becomes a no-brainer to stick onto it because hell, it's working. I feel a lot better. I know what to eat and what not to do. And then if they, after that, if they want more coaching, that's great. you know. But generally, most people after 4 months are kind of like, I'm kind of this catalyst, you know.
Mm-hmm.
It's like to quickly, what might take 10 years to do, and by that time your kid's 10 years older.
Yeah, yeah.
It takes 4 months. So
And
I'm
then
the family health catalyst.
how do you deal with, like you mentioned, the problem child, or the child that doesn't respond to the picky eater, or the kid that has a hard time giving up there, because that's often an obstacle, right? When parents are like, well, I could never do that to my kid who, loves sugar or loves playing Fortnite or whatever, you know.
Yeah, yeah. There's all sorts of what I believe is erroneous assumptions
Mm-hmm.
and fears, unfounded fears that we as parents have. I think a lot of it comes down to not wanting to be over controlling or overbearing
Mm-hmm.
or cause our child pain in any way. And maybe this is subconscious, but when your kid is crying, that's a sign that they're in pain. And if they're crying because you're not giving them the food you want, you feel like an awful person. Like I'm their parent and I'm putting my child in pain. That's what it feels like. But um, another thing that people might think is like, oh, I'm gonna cause an eating disorder by limiting what they eat. So some
Right.
people literally just believe you just let them eat whatever they want, because if you're controlling them, they're gonna develop an eating disorder. And I compare these fears to like the attitude that, oh, I'm just gonna let my kid play with a gun or run out in the street. Like as a parent, as much as your kid wants to go play in the freeway, like don't
Mm-hmm.
let them play in the freeway.
Right.
and and it's really because these kids, they don't know the consequences. If
Right.
they if they did know and they could cognate what the consequences are, they wouldn't want to eat that junk food.
Mm-hmm.
But that's what we're there for as parents, is to protect our kids. There are very real dangers out there, and one of them is the mainstream food system. It is very toxic and very damaging to kids, and I'm going to strongly assert that. And
Mm-hmm.
our job as parents is to protect our kids, and if we're not doing that, then um, then I mean, and I'm not trying to be accusatory of parents. We're all trying to do our best. Like we love our kids. That's why we do these things, but we just don't necessarily understand the consequences. And a child, like I mentioned, like with this blood sugar curve, like the kid gets happy, right, when they get the sugar, but then they crash, they're less happy. The kid is going to be a lot happier.
Yeah.
Trust me. When they're eating healthier, their moods are going to stabilize. They're going to get interested in other things to make them happy. They'll just be calmer.
Mm-hmm.
They'll be so they're going to be happier. Also, a lot of times during the initial part, where with the dietary change, where it's like, oh, we're not eating this anymore or whatever. I don't know if I would use those terms. But as we're saying no and redirecting the kids, there's a lot of psychology behind it.
Yeah.
Point being, at first the kid's going to put up a big, huge fuss,
Mm-hmm.
maybe throw tantrums. It's going to be dramatic and everything. One thing about parenting, though, is, loving firmness. Like if you're loving, they know you're on their side. It's
Right.
not this like, no, you can't have it, and yelling at each other and stuff like
Yeah.
that.
Because
It's
you're a
like,
bad
oh,
kid.
I know you
Yeah.
want that, but
Mm-hmm.
you'll be fine. But just that assertiveness, that firmness, that consistency. Pretty soon, the kid, sooner or later, is going to realize like, oh, throwing a tantrum isn't going to work, and
Mm-hmm.
then suddenly they're fine with it. you
Right.
know and it's because they know that you have that firm boundary with them. And kids are smart, and
Yeah.
they'll be like, oh, I'm not going to get it, okay, whatever, I'll go do something else you
No.
know
I remember, like, I have this memory of me as a young kid, I think, sitting beside the stove, like wanting to touch the burner. And my
Oh.
grandmother's like parenting, she's Italian, she would like whack my hand away. Like, no, I'm gonna touch it. And so then I touch it and learn my lesson. And so it's sort of like that. It's like, but I was obviously probably screaming and being a brat trying to touch the burner.
Mhm.
So I think, it's interesting what you say. I mean, I also when I'm working with parents and their kids, well, first of all, it's hard. That's what I want to say. It's hard for us to even notice that something might be related to blood sugar. It's hard for an adult to put that together. And that's why all of the health education that you introduce everyone to, all the knowledge, that we can actually make those connections. Because if we made those connections easily, it would probably, like you said, be a no-brainer. So what you're helping is to pair those things. Like your 4 p.m. crash is related to what you had for breakfast or what you didn't have for breakfast.
Mm-hmm.
And nobody really knows that. I mean, most of the people that come into my office have no idea that that's going on, and you have to sort of paint it out, and then introduce someone to an experiment where they try following your way for a while and observing how things shift. And you even, it sounds like, do a lot of focus on getting someone to the place where they can even pay attention in a meaningful way to even understand what's changing in their body, because so
Mm-hmm.
many of us aren't aware how we feel.
Mm-hmm.
And that's, I had a conversation recently where someone was like, well, so many people just eat junk food, let's say, and they are fine. And I'm like, well, a lot of people don't know what it feels like to be well, truly,
Exactly. Yeah.
and then when you start thinking of a child, when I've said to parents before is, because I think there was a parent who, her son would follow like a pretty healthy diet at home, but then go and visit friends or cousins and come back having eaten a bunch of sugar, gluten, things that she recognized weren't that great for him. And it was like, well, he's okay afterwards. I'm not really noticing a huge shift.
Mm-hmm.
But one thing I said was, it's hard enough for us to recognize how we feel. And then
Mm-hmm.
when it's a child, you're often looking for a behavioral change, which is another level of the shift of your internal state. So he might come home feeling kind of brain foggy, generally crappy, but may not say anything.
Mm-hmm.
There's motivation to not say anything
Oh,
if you want the sugar, you know.
yeah.
But a kid may say something offhand like, "Oh, my stomach hurts," or you might notice a tantrum, or you might notice an emotional outburst, but maybe not. Maybe it doesn't get to that point because it takes enough inflammation to build up to that point. So it's tricky to watch for
Mm-hmm.
that in kids as well. And it's really hard for them to make the connection. Um, so part of the journey is to like allow those connections to be made. And so, yeah, a kid may not be able to sort of self-regulate their food intake in the context of all of these different food additives and chemicals and added sugars and all the things that are hijacking their own internal wisdom, you know.
Exactly. Oh yeah, for sure. Yeah, like just you saying all that, I'm having flashbacks of my own childhood. I
Yeah.
remember jumping on a
Sorry.
trampoline with my friend and suddenly just having to lay down and like, oh my God, I'm so hungry, you know?
Yeah.
And I'm like, do you have any food, And at the time, I was just like, oh yeah, I was hungry. But now looking back, I'm like, that was like a low blood sugar thing. Like
Hmm.
that was the crash. I experienced that. But as a kid, what am I supposed to think? Oh, I'm hungry, you
Yeah.
know?
Yeah.
And, and then I had like eczema, I had, like I said, IBS, and I just thought that's how I was. I had no idea it had anything to do with what I was eating. You know,
Yeah.
I was eating, ramen, macaroni and cheese, and who knows what. So,
Yeah.
um, yeah, and again, like even now, like even as I got older and honed everything in even more, um, I do recognize if I, start eating more starchy foods and sugary foods, then I do get that like
Hmm.
hunger, and whereas if I'm eating more cleanly and more, veggies and healthy fats and stuff and protein, then I get hungry, but I'm not ravished. And
Where you're ready to like murder someone for their bagel or whatever. Yeah. Hmm.
that's another thing I teach people is like, when your blood sugar is going up and down, it's super hard to have the willpower to not stop at Wendy's or whatever
Hmm.
and
Right.
grab something because like you're so hungry.
Right.
And yeah,
Well, yeah, I mean, then you just become, I mean, if you're hungry, there's a saying, my mind is like totally blanking on it, but it was something, maybe it's Nietzsche talks about,
Oh,
I'll find it for the show notes, but
nice.
it's, something about the rational man and hunger. Like there, there's no such thing. Well, ultimately, that, like, yeah, you become reduced to food when you're hungry, so you're all limbic system, but also there's no energy for your prefrontal cortex. So this idea of like decision fatigue, patients will talk about, or
Mm-hmm.
just feeling blah at the end of the day, not being able to transition from work to something that's fulfilling, where they sort of work and then they just recover from work doing something kind of mindless, and then they go back to work the next day.
Mm-hmm.
And being on this treadmill is as often that we've run out of steam for our brain, and we can't make decisions, we can't engage in something else, we don't have the motivation to like get out our paint canvas and that kind of thing. And and a lot of that has to do with, and so people feel like it's their willpower, they're sort of moral failing, but really they're just out
Mm-hmm.
of energy, their brain is out of energy.
Exactly. Yeah, that's huge. Yeah, yeah, that moral failing concept is interesting because so much of how we function
Yeah.
is physiological. Um, and that again, that makes me think of my childhood, with like I had social anxiety and I thought that was such a moral failing and like I was a bad person and I was weak and so these and I and it was related to that brain inflammation and stuff like that. Um, what was my train of thought? Um, anyway, lost my train of thought.
Well,
It felt like it was a moral failing,
yeah,
and but just getting the body healthy, everything functions so much better, like so much
yeah.
happier. Um, I really like that car analogy you used earlier. Like you have this Ferrari and you don't know how to drive it.
Mm-hmm.
Uh, I like to compare the driver as like your psychology and your thought patterns and more of like your inner decisions because you're the driver.
Mm-hmm.
But what if the Ferrari has a flat tire? Or what if
Right.
the spark plugs are missing? Like that's the physical thing. Like that's like your physical body. Or the alignment's off and you keep going into the rut. Like we think that it's the driver, right? We
Right.
blame the driver, but really the car is what needs to be fixed. And that's the physiology. That's, you know, the physiology has a huge impact on the functioning
Mm-hmm.
of the person day to day, your ability to focus, your ability to recuperate, ability to be creative, your ability to stay cool, so it helps relationships when your physiology works better because you're in a better mood. I
Yeah.
mean,
And that's the other thing is like the meltdowns at 4 p.m. for parents as well. Like a lot of my, let's say like 40 to 50-year olds, mainly let's say female patients, deal with that, like feeling very irritable with their family. And again, that's another blood sugar thing, or just, running out of fuel. And we associate that, yeah, with the driver, like
mm-hmm,
you said. It makes sense. Like if you're, and when you're learning to drive your Ferrari, you're not confident in it, right? So you're a child, you have social anxiety. So you may have had one experience of being really anxious or something went wrong socially.
mm-hmm,
And we encode that, we remember it. And then we create a story and we create an identity around it because now and then it happens again. So you're the Ferrari driver, you're driving into the ditch. Oh, I'm a terrible driver. I'm going to head into the ditch every single time I go around this corner. And then it keeps happening.
mm-hmm,
And it started off as, yeah, the steering wheel was out of alignment, right?
mm-hmm.
And now it becomes part of the identity and part of, then you might get a diagnosis. Now you might be prescribed a medication for it or go to special therapy for it. And all of that might be useful, but we still have to correct the steering alignment eventually, right?
Right. Yeah. Because if your baseline anxiety level is higher because you have inflammation or your blood sugar is not
Right,
balanced, it's just going to set you up for those same patterns.
right.
Get that anxiety down, and then it becomes a lot easier to overcome those traumas and
Yeah.
habits of thought. And yeah, it's complicated. But with kids, kind of getting back to that, they are under development. Their bodies are developing. Insulin is probably the master hormone. So if blood sugar is not being controlled, the child's hormones are going to be out of control. And it's really important for those kids to go through puberty, having balanced hormones, for everything, for their body development, brain development. And so, I mean, the effects are so far reaching. Schizophrenia, and other schizophreniform disorders are associated with, you know, it, immunological inflammation. And that in turn, again, is related to nutrition, and lifestyle factors. We really want to get that microbiome healthy. And the only way to do that is for the kid to eat vegetables.
Right.
There's no way around it. And, but not that we want to find a way around it, because like I said, it's worth it. It becomes a no-brainer when you understand the consequences of that. Yeah.
You also have, like you mentioned, and I think this is relevant to bring up, is so you have experience working with eating disorders, and you mentioned, one of the fears is that people, like, there is a lot of talk around orthorexia, and I'm aware of the conversation around shame and lifestyle habits, and I did an Instagram post on this about, I'm not into restriction in that sense, where it's like taking things away from you,
Mhm.
depriving you. But I am personally in favor of quitting things, whether it be an elimination diet, like I quit coffee, we were talking about, and not because it's like, you know, necessarily some like self punishment. It's more of an exploration to see where these things fit in my life. Like,
Mhm.
is gluten inflammatory? The only way I'm going to find out is with an elimination diet. Is coffee helping me or harming me? Let's cut it out for a while, see, and then I gain some control around my relationship with it. But I think, I don't know. I mean, I don't quite have my finger on this, but I see a lot of people interpreting that as like as shame, and it's okay to have the ice cream. I think what often happens is there's a lot of shame around food and this sense of feeling out of control. And we're at the bottom of an ice cream tub. We feel intense guilt and shame,
Mhm.
or we can't get our kids to um, eat healthy. And we
Mhm.
feel or the idea maybe that our child may be suffering health consequences of something going on with their diet is shame inducing.
Mhm.
And so I'm wondering, with that connection, or how you might, you know, assuage the concerns of, focusing on food leading to disordered eating, especially
Mhm.
when people are young. Yeah.
Yeah. So it's all about the emotional valence and energy behind conversations about it. So what comes to mind is your grandma just, no, don't do that, right?
Because
A
it's
lot.
very Catholic, right? You have to like shame people if you want to get them to change their behavior. Yeah. And maybe
Exactly.
that's also part of it, is like we have that in our history. It's like, well, I anytime someone wanted to motivate me to do something, they use shame-based tactics. So anytime someone else is motivating me with it may be self-compassionate, or maybe compassionate, but I'm going to see that as, I'm going to connect that to shame because it's
Mhm.
connected in my mind or in my experience. That could be part of
Right.
it too. Yeah.
Yeah, no, there's very much a negative, energy behind a lot of this,
Right.
eating concept, and I understand that. Um, so very much like your grandma was like batting your hand away. A lot of girls, especially,
Mm.
um, literally will probably have parents that are like, "Don't eat that." You know what I mean? Don't eat that
Stuck in your
cake.
stomach. Yeah.
Yeah, that's bad for you.
That's too
And
much
that,
food. Yeah.
yeah, that's too much food. Um, and that's why I emphasize with the parents that, you need to maintain that empathy. Like that is massively important. Like this is a loving thing. You love your kid. Your kid knows that you always love them, and I think that's in question with, a lot of girls that get,
Mm-hmm.
eating disorders. It, um, it becomes this self-worth thing, and I need to lose weight to, look better. Can you hear that fly?
No.
Good. I hope that's not on the podcast. Um, so yeah, so there's this very, it becomes about their self-worth.
Hmm.
You know what I mean? Instead of, I love you, I want you to be happy, so I'm feeding you foods that are going to support your growth and development and make you happy. So that's what
Which
I
is
feel.
honestly how we should maybe talk to ourselves when undergoing a similar journey, right? Whether
Okay.
we be trying to encourage our kids or not, which is
Mm-hmm.
an important distinction, actually. I like that because I think maybe that's what I'm seeing where someone is calling something orthorexia. It seems to be associated with body modification versus
Mm-hmm.
just health. Like it's
Mm-hmm.
not, so not consuming cow dairy. Like in my experience, it's been a process of trial and error, continual trial and error.
Mm-hmm.
And yeah, sometimes feeling like I couldn't say no to the tiramisu, but then experiencing specific symptoms afterwards or noticing,
Mm-hmm.
being
Mm-hmm.
aware of how it's starting to interact in my body. Some of that's knowledge based, some of that's experience based, and then paying attention over time and coming to the conclusion that it's not worth it to have it.
Mm-hmm.
And it's
Right.
not, which is ultimately where you want people to arrive at, right? If and
Mm-hmm.
or they may say like it's worth it, I'm gonna keep eating dairy, like I don't care.
Yeah.
you know
Yeah. Yeah. And if the mom and dad, if the kid knows that their mom and dad love them
Hmm.
and they're not judging them about for wanting to eat sugar, I mean, that's
Yeah,
normal.
yeah,
Um, and even, if we, yeah, there's so much to it actually. Um, but also, there is another pitfall of orthorexia is it can increase your anxiety, right? If and let's face it, it is work to change your dietary habits, like, to just go with the flow and eat what everyone else is eating.
yeah,
Um, in the short term, especially, it's easier, you know. Um, but and then it is harder to change the dietary habits. But once you're in a flow and you have the knowledge and you have made the transition, it's pretty easy.
hmm,
It's easy to maintain it. But you could be too extreme about it and stress excessively about any minor slip up. I mean, let's say you're traveling and you don't have access to what you would normally eat. um, I'd say it's okay, to eat, not ideally,
yeah,
um, and I'm at a place where I'm self-motivated. It doesn't take a ton of willpower for
yeah,
me to eat the way I eat, because I know the consequences. A lot of people think I'm super disciplined, and I'm like, I would argue with that.
yeah,
It's just like I kind of know the consequences. I did the work to be mindful and conscientious about the consequences. Now it's just self-motivating, but um, but it is important, I think, to go through that phase of strictness. That's why the elimination diet is super important. um, I think it's important to go through that so that you have the mindfulness and awareness of what the consequences are. And
hmm,
then after that, it's self-motivating, and you can, cheat occasionally and do, um, eat stuff that you normally wouldn't. That's fine. So we're finding that happy balance of like not wanting someone to be excessively stressed, because that can cause eating disorders if the parent is, just excessively controlling, and it comes from this external place of, mom is making me not eat these things, and when I go to school, she's making it so I can't eat what the other kids are eating.
right,
I think, you want to be careful about that. You don't want the kid to feel, super different from their peers. Um,
hmm,
I think if they have a baseline healthy diet, their physiology is going to be able to handle those, things without, too much trouble. But once they're immunologically compromised or metabolically compromised, the consequences are going to be much more real. For example, if
hmm,
they do develop a dairy allergy, then
right,
you are going to need to be more strict. Whereas if they haven't developed that, then maybe they can eat, you know, um,
right,
I mean, and there's better forms of dairy and worse forms of dairy, but you know what I mean? Like,
yeah,
um, if they're having a good baseline diet at home, it might be counterproductive to be over controlling. And that's a major concept in parenting is, there's the helicopter parent that's controlling everything, and that's going to cause issues in the
Right.
child. Then there's the other extreme of the parent that just doesn't care at all or doesn't do anything.
Just
We're
says
trying
like,
to find that middle ground of
yeah.
what's that?
Just says like, oh, you want Doritos for dinner? Go for it. Yeah. Yeah.
Yeah,
Mhm.
yeah. So we're trying to find that golden mean area of.
There's a few things there. So yeah, the period of strictness is like, what's the goal there is to gain clarity. It's not to see if you can do it or see how, how much control you have over yourself or if you're a good person. It's just like,
Oh yeah.
we're going to take it away so that we gain clarity
Mm-hmm.
over how these foods interact with the body. That's all. And after the period is done, then we can decide what to do about it, right? Which I think is a really important distinction because it gets confused where a lot of patients will come to me and they've seen another practitioner before. Maybe they've tried an elimination diet on their own and they're like, oh, or they've done a test. It's often a test actually. And they're like, oh, I can't eat almonds. It came up on the test, but I eat almonds. And so there's this experience of failure and
Mm-hmm.
however they kind of connect to that failure. But it's this thing of like, I got this test or I did a diet and I kind of just ate it again. And I
Mm-hmm.
feel I don't know if I feel different. And so the clarity wasn't achieved. The purpose of the assignment wasn't clear. So they didn't get the clarity and they also just feel like they couldn't do it or it was too difficult or wasn't worth it or that they failed in some way. Um, and I like when you said, when you go on vacation, okay, it's going to be impossible to avoid gluten because you're going on vacation to India. Okay, well, just pay attention when you're eating something with gluten in it. Let's use this as an exercise because our goal is clarity. Let's just focus and observe what you feel when you eat chapati or whatever, you know? Um,
Wow. Have you gone to India?
yeah, yeah. I use it as an example because it's easy to be gluten free, like, but if you have celiac disease, I've had friends that went who had celiac disease and had to come home early because there's just, I mean, you're so sensitive to any sort of gluten, and there's obviously cross contamination in certain cultures that will use wheat. So in Vietnam, it was easy to be gluten free. Although the word for cake bread, including gluten free bread made of rice, is all ben. So it's
Mm-hmm.
sandwich. So it's like hard to ask if something is wheat or rice or, but they'll make like rice waffles, so that was easy.
Wow.
Yeah, interesting. But to be celiac is different, right? And if you're on a complete elimination diet and you really want to take something out to see, it's difficult. Um but I like that of, being very clear, what's the goal of this exercise.
Mm-hmm.
um and then the
Yeah.
other part of, self-compassion and then empathy when you're trying to guide someone else through it. um and I also like your point about the self-motivation because, yeah, to me it isn't restriction either. If I don't have gluten, it's this understanding I'm not going to feel good after, and I don't want to not feel good. It's like if someone was like, hey, let's just stay up all night and binge watch this show, I'd be like, well, I'm going to feel terrible tomorrow. So
Mhm.
even though it's sort of appealing, it's not
Right.
appealing enough that I would do it. And so it doesn't feel like a hurdle to
Yeah.
say no.
Mm-hmm.
But I wonder if you have tips on that, because that's a common thing is when someone goes to a party or they are now interacting with their mother-in-law and certain family members, like we talked about before we recorded about this, the community, right? Like the tribe where we, part of human nature is wanting to connect to who we associate with
Mm-hmm.
and eat and behave in the way that makes us feel connected to the people that we associate as our community. And when you start making radical changes, which may be more in line with human biology and what we should be eating, but is very different from a society. When you're in a society that eats, Doritos for dinner sometimes, and now you're following this new plan, how do you make recommendations when someone is now reintegrating into the other spheres of their community that might not be accepting of their new lifestyle changes?
Yeah. So years ago, I wrote a little booklet that I share with my clients called Eating Mindfully. And, for example, the party that you mentioned, um, there is a point where, if you're constantly feeling deprived, that's not a good thing. But if you're mindful about it, you can have that eclair or whatever it might be.
Mm.
But my point, instead of feeling guilty about it or bad, I'm like, if you do that, good for you. Like, go all in,
Mm-hmm.
enjoy it. Like, sit down, eat it slowly, like, savor it.
Yeah.
Because what your mind is looking for is that enjoyment.
Mm.
And you can eat something mindlessly and get just a fraction of the enjoyment out of it because you're distracted by your self-loathing or the stress of like, oh my God, I shouldn't be eating this.
Yeah.
And then what's going to happen? Well, you only got this much enjoyment. You're going to want to eat another one so you can get a little more,
Right.
you know? So my, you know, point is like, if you enjoy it, if you're mindful, if you're present when you're eating it, you can get that full enjoyment and just eat a lot less of it. And I'm not about restriction, but around stuff like that, like there is a big difference between eating one eclair and eating a whole plate, right?
Mm-hmm.
And again, there's all the other aspects of mindfulness, like having gone through the illumination diet and being aware of the
Mm-hmm.
effects and everything. Um,
Mm-hmm.
but the other side of the coin of being mindful, like you were saying, is after you do eat whatever you do eat, like keep being aware of how you feel later, and that's the other side of the coin. And when you do that, I think just mindfulness brings this awareness, and the awareness makes decisions pretty easy because you're aware of it now. Um, Whereas a lot of times people are like, oh, I shouldn't be eating this. And then they're shoveling them in their mouth. And then it's like, oh, I'm going to gain so much weight. And then, they're just eating
Right.
it.
And
And,
you tell your subconscious that that's gonna happen. Yeah.
uh,
Yeah.
there's another aspect of your question.
Mm-hmm.
Trying to remember.
The yeah, like navigating the parties, the social situation, or that you know other people maybe attempt to sabotage, maybe with good intentions, but I'm thinking like the mother-in-law that's like, oh, what do you mean your kid is not eating white flour anymore? Like,
Uh,
yeah.
yeah. Yeah. So again, like having a good, like loving,
Mm.
disarming attitude about it is very good. Like, oh yeah, he feels so much better when he doesn't. And rather than saying, oh, those are bad, because that focuses on the bad food,
Mm.
you want to focus on the good. Like, oh, he feels
Right.
so much better when he eats these other things.
Yeah.
He's just so much happier, and so it's a good thing for him.
Mm.
And
Mm-hmm.
it's really helping him out. And who's going to feel okay giving a kid something bad after that if they know it's going to make them feel bad? You know
Right.
what I mean? Versus, oh, that food is so bad for you, and then the other person's going to think, well, there's no harm in eating it once, and maybe there's not. I'm not a Puritan. I think, um, again, after you've gone through that period of mindfulness, I think you can make more
Mm.
choices and kind of monitor how you feel. Do you feel really deprived? Well, what's under that?
Mm.
Maybe you do need to find a treat that you enjoy, like dark chocolate or
Mm.
something.
Mm-hmm.
uh, yeah, you know there's a lot to it. And as I'm coaching people, it's identifying what it's like this psychological jujitsu, right?
Totally. Yeah, totally.
Mind is like a maze, and we're
Yeah.
trying to just like navigate all of it.
Yeah.
And life
I
is.
like that though when you say, I mean, he feels so much better without it because there's nothing you can't really argue with that. It's you're not
Mhm.
focusing on the food where it leaves open. Well, you know, or they did a study and organic food is not more nutritious, so who cares? And it's like now you're in a debate when you just say,
Mhm.
you know what, this is something that we've done, and we all feel a lot better, and the teachers are commenting. It's like, well,
Mhm.
there isn't a lot of room to fight with that or to engage with that, you know? Um,
Yeah, and my kids, I have 4 kids. The younger 2 are younger, so they'll go to parties. They're not necessarily aware as much.
mm,
So there's a few things I do. Like I'll try to feed them healthy food beforehand.
mm,
And when you're not hungry, like
yeah.
you're not gonna feel deprived. I don't restrict them. I don't say,
Mm,
you can't have the cake or the ice cream at the party. I just try to feed them ahead of time and then let them go.
right.
Um, and even at home, we'll have like gluten-free cake and stuff like that for birthdays. Um, and there's a huge difference between having had a healthy meal with a balance of lots of veggies and healthy protein, and then eating the cake
Mm,
versus, just being hungry and starting with the cake.
yeah. And
Um,
that is like, yeah, that's one thing I will sometimes tell my patients. I'm like, have protein and produce. When you want to binge on the like whatever it is, President's Choice ketchup chips or whatever the specific thing is,
uh-huh.
have protein produce first, whatever it is, one olive, one piece of turkey, and then have the chips. And just to see, because maybe you don't, maybe it's not the chips, maybe that's just what you associate with restoring your blood sugar levels or getting some, making up for a calorie deficit that you had throughout the day that you always make up for around 5 p.m. Like your body's accustomed to getting 1,000 calories at that time to make up for a deficit that was incurred. Um, and so, yeah, that's a good strategy is to not go somewhere hungry, not to, because one, there's the classic story I tell a lot, like a patient who she's like at 10 a.m. I'm at my office and I'm eating my healthy snack and I know what I and I have conviction and I know that my day's going to go well and I'm going to make healthy choices. And then at 4 p.m. they put donuts out in my office and I just go to town on the donuts and then everything kind of goes out the window after that and I feel bad about myself. And it was like, well, at 4 p.m., when did you have lunch? You had lunch at 12. You're hungry at 4. And then someone puts out donuts and no homo sapien that's hungry is going to say no to like this like smorgasbord of fructose and glucose to like get to feed yourself. So having a snack around that time might be a good strategy, understanding that it's not like willpower in so much as it may be actually blood sugar.
Mm-hmm.
And with kids too, it's I had this interesting experience a few years ago. I quit alcohol, so I was I I wasn't like that much into alcohol, but I cut it out completely and I cut out sugar. And I'd get invited to parties. It was around Christmas time. So I was getting invited to these Christmas parties, birthday parties around that time. And I'd go first with a little bit of anxiety. Like, are people gonna, people don't really bother you if you're not drinking usually because they think like maybe they don't really want to know the story. So, but I noticed that I'd have an expiry time on my time at a party. I'd go for about 2 hours and I'd talk to people and then I'd sort of feel like, okay, I'm good. I'm gonna go home now. And what I realized was the sugar and alcohol would keep me there longer. It was sort of like give me that like continual dopamine hit to kind of keep me at the party, and that's what the after those 2 hours what it was about. And without those substances, it was able to sort of just see whether I was enjoying myself or not purely.
Mm-hmm.
And then I'm actually tired, and my tiredness is overwhelming my sense of enjoyment at this part. I'm going to go home. And at first, it was like, oh, I don't know if that's a good thing. And then after, it was like, no, it's just you're done here. Like it was very interesting, and I wouldn't have noticed that if I was essentially medicating in some way, right? Like,
Mm-hmm.
oh, I'm here
Right.
for the sugar. Oh, they're bringing out another snack.
Uh,
Um, and so I think I don't know how that relates to kids, but it's interesting too. It's like maybe now parties become just the party and they get
mm-hmm.
to go. They're not going hungry, so maybe they get to enjoy the cake just
Yeah,
for the cake.
yeah,
And
just for the cake and then have fun. And they're
yeah,
not physiologically hungry, so that's not the emphasis. It's not the cake and stuff. They're not.
Yeah.
hungry, and certainly not like in a blood sugar slump, right? I'm not going to eat half the cake.
Right.
Um,
Like after, like the parent probably like after a birthday party, there's usually like some kind of meltdown or like low thing, or somebody starts acting out just because probably so much everyone's like insulin is now at an all-time high and their blood sugar is probably tanking.
yeah.
And you know.
Another thing, this is loosely related, is the fact that hunger is the best sauce.
Mm-hmm.
Meaning, if the
Right.
kid, what the kid eats when they're hungry is going to taste extra good.
Mm-hmm.
And so, when the child is hungry, that's a really good time. Like if we're trying to change their taste buds, because people's tastes change according to what you eat, right? Like at first, the kid prefers what they've been eating because that's what they've been eating. That's what their brain associates with food and nourishment. So they have all these associations and tastes. We're trying to change the diet. They don't necessarily, they're not used to these new foods. They don't have a taste for them. It doesn't mean they can't,
Mm-hmm.
but, and that's another thing we have to teach parents is, they think, oh, my kid doesn't like that. And then that's the end of the story. So I can't feed them that. And I'm like, wait a second, they can, I don't like to use the word learn, but they can come to love it eventually. And again, it's through that exposure. But when I say hunger is the best sauce, what I'm saying is like when they're hungriest, like in the morning, what you feed them, their brain is going to make strong associations with, I like
Yeah.
this.
Mm-hmm.
Because when I ate this last time, it satiated my hunger.
Mm-hmm.
And so they're going to start liking what you feed them, especially when they're hungry. And that's a big reason why before they go to a party, I like to make sure they're not hungry.
Right.
So they're not like, oh my God, I love that.
Yeah. Right. Because it regulated me in addition to tasting great.
Yeah.
Yeah.
Mhm.
Mm-hmm. This is good.
Um,
Yeah.
yeah.
Any
So we
last?
get kids to enjoy liver. Liver is a superfood.
Mm-hmm.
Um, a lot of parents are like, I'd never eat liver. I'm not going to feed my kid liver. And I'm like, well, what if it's super healthy for them and they enjoy it? You
And
know?
babies love it. I remember like being obsessed with pate. It was the most delicious thing ever because
Mhm.
it's so nutrient. I mean, that's our taste buds were designed to get us the most nutritious stuff ultimately, and that got hijacked, right? But
Mhm.
if you give, there's actually been studies. If you give babies a bunch of different foods, they'll balance their diet out over time, just based on what their taste buds are telling them to eat.
Yeah.
And but that
But that
is,
only works if
yeah,
it's whole foods, right?
exactly. Yeah. If it's Doritos, it's game over because those foods have been engineered for. There's a book called The Dorito Effect that's about that, but
Mm,
there's foods that have been engineered to hijack those taste receptors, pleasure centers. I mean, where would we have gotten sugar from fresh, ripe fruit, high in nutrients? Now you get it from everything, right? So
right.
your
Yeah.
body is, you can't let that guide you unless you sort of wipe the slate clean.
Yeah. Like, ancestrally before
Mm.
modern food processing, sugary foods were really healthy because it was the
Yeah,
berries. It was super loaded with
totally.
antioxidants,
Yeah.
so that maybe that's why
Apple. Yeah.
yeah, apples, things that are really good for us. Vitamin C, some
Yeah.
of the best sources of vitamin C are, you know, we're slightly sweet. So
Yeah.
there's a reason we seek it out. But yeah, like you said, with modern science, we have hijacked that, and so the concept of intuitive eating is extremely important and it's valid. Like that's basically the baby has an intuition of what it needs to
Mm-hmm.
eat, but intuitive eating doesn't work if you're eating processed food.
Mm-hmm.
It's
Mm-hmm.
like throwing a wrench in that intuition.
Yeah.
So
Yeah. And when blood sugar is unstable, it's difficult to be intuitive. Yeah. I love the concept of intuitive eating. But I think there's different stages. Like I see a lot of people embrace intuitive eating after a period of very restrictive dieting, and they eat a lot of donuts and that kind of thing, which is, we're snapshotting that may be actually very healing to that person in that moment, in that snapshot in time, to get to replenish calories in a very
mm-hmm.
fast way by eating a ton of donuts. But I think once, intuitive eating seems to be like a journey that you can't just take a snapshot and declare that that's what it is. But I think, at least for me, I was able to get to a place of intuitive eating from eating whole foods only, and that will always be hijacked when I eat sugar, like a lot of refined sugar. So that was also an intuitive, mindful realization that I
Mhm.
came to on my own. It wasn't because I read it or someone told me don't eat sugar because it'll hijack your intuitive eating. It was something that was like experienced directly. So, um, but yeah,
Mhm.
this is yeah, it's great. Like these tips on mindful eating, intuitive eating, combating guilt and shame, I think are all really relevant topics when we talk about nutrition. It's unfortunate we have to because it's really just. I mean, back in hunter gatherer times, there was no. We just ate,
Right.
what you
Yeah.
could, and
Yeah. Yeah.
yeah,
Yeah. We have to consciously do what we just naturally did in the
yeah,
past. And no wonder modern life is so stressful.
yeah. But I think that that's a theme of what I forget who said this, but like all modern sort of biohacking, like cold therapy and blue light blockers and sunlight exposure, is all just stuff that we naturally had as our
Yeah,
human birthright, and now we have to kind of recreate it and overcome. It's like technology solves the problem of technology.
exactly. Yeah, we're just layering more technology onto our technology.
Yeah, so we have like cold plunges, but meanwhile, like a few months ago, it was like -20 out here. It's like I could just sit on my balcony with a t-shirt. Like I don't need to buy a cold
Yeah.
plunge. but but yeah. Any last thoughts, Nick? This is great. This has been a great talk.
I mean, one thing that
Yeah.
I just wanted to share, kind of throw in there is, you mentioned the social setting where you were the alcohol and sugar. Um, another thing I wanted to point out is that sugar does increase serotonin levels,
Yeah.
but so does social connection and support. And I think, my theory is that we do tend to kind of binge on sugar and stuff at night. Partly, I mean, there's a lot of reasons, but I think one of them is I think we're so isolated in modern life. I mean, especially with COVID and stuff, but even before
Yeah.
COVID, we want that serotonin, which normally I think traditionally we would get from surrounding ourselves with loved ones and socializing, and it releases the oxytocin and the serotonin. Um, but instead we have our engineered sugary, salty, unhealthy snacks,
Great.
and those are giving us like some sort of surrogate comfort, and so that's just another thing to throw in there in terms of how all this is kind of messed up.
Yeah.
That's what I'm trying to do is get people to understand these things, and then have a roadmap and an understanding of how to implement it.
Mm.
And I do want to emphasize that life is a whole lot better on the other side.
Yeah.
Once you're aware of all these things and eating healthy, I think people focus on the deprivation and get afraid of, oh no, I can't eat my favorite foods anymore. And I just have to reassure you, like, no, if you're once you've done this work of being aware of it and doing these experiments, it becomes self-motivating, and you won't
Mm.
want to eat that stuff,
Yeah.
you know? So,
And it's good, yeah, to think of food inclusion. Like anytime I'm sharing a low FODMAP diet with someone, which gets results very quickly. So it's easy, ultimately when you're starting because you get benefit right away if you're experiencing IBS symptoms. I show the restricted list and you see people are like, oh no. And then you show here's the low FODMAP foods that you can focus on. They're like, oh, I like that food. So automatically there's a frame shift when you focus on what you're eating versus what you're taking out, because it becomes overwhelming when you're like, I can't eat that or that. What am I going to have for what am I going to have for breakfast? And when you just have a list of breakfasts and recipes and things to focus on, it becomes a lot easier
mm-hmm.
psychologically. Yeah.
Yeah, and that's interesting too, because if you think about it, the Western diet is actually extremely limited.
Right.
Like I can't remember, some massive proportion of our calories ultimately come from corn.
Yeah.
And
Well, isn't it 65% of the calories come from seed oils.
Wow. Yeah. So like
They,
we're
yeah, they're
like
like completely nutrient devoid, not
Western
even good.
diet is
Yeah.
there's permutations of like seed oils, corn,
Yeah.
dairy and wheat, right? Like
Yeah.
that's probably like
Yeah.
70 to 80 or more percent of what we're eating. And it like ultimately is extremely narrow, but it's all modified to
Mhm.
create, turn it into a donut here and then macaroni here,
Yeah. Yeah.
and
It's like I had
Doritos
toast for
over here.
breakfast, then I had pasta for lunch, and then, but it's all
Yeah.
wheat. But that's the problem. So it's to reframe that as, okay, here's, and also meaningful substitutions I find are helpful. Like, let's switch out the wheat pasta for one of these legume pastas now that they make, which are, I think most of them that I find are pretty clean, and then it's a protein source. And so if you just want a quick pasta night because you got stuff to get to after school and all this stuff, and you just got to get food in everyone, then that may be a really helpful solution. Or, um, what's a snack you can have? Like these kind of things can be helpful. Um, yeah, so it's good to have the guidance. I think that's really important, like you were saying, to be able to guide people through the process, and that seems to set them up for success.
Mhm. Yeah. Yeah, it's super exciting. And again,
Yeah.
it's super important. I get passionate about our future generations. I mean, I haven't even gone into the metabolic damage and immunological damage that our kids are facing because of the environment, you
Yeah.
know, the toxins and then the food and everything. And so it's really important. And these kids, they're developing, their organs are developing, their brains are developing, and it's setting up a foundation that they're going to be living with for the rest of their lives. And our job as parents, like I said, is to protect them. um, I'm not trying to stress anyone out, but I am trying to motivate about the difference that you can have in your child's life by getting the nutrition squared away, because the consequences can be um, either really good or really bad, depending on the direction we go.
Thank you, Nick. This is
Yeah.
great.